vignettes focused on screening guidelines, USPSTF recommendations, and vaccinations, each with 4 answer choices and explanations. Screening guidelines and vaccinations, clinical vignettes, cancer screening. 1. Breast cancer screening. A 45-year-old woman with no family history of breast cancer comes for a wellness visit. According to USPSTF guidelines, when should she start regular screening mammograms? A. At age 40 annually. B. At age 50 annually. C. At age 50 every 2 years. D. At age 40 every 2 years. Answer: D. At age 40 every 2 years. Explanation: USPSTF recommends starting biennial mammography at age 40. 2. Cervical cancer screening. A 30-year-old woman has no prior abnormal pap smears. What is the recommended screening interval for cervical cancer? A. Pap smear every year. B. Pap smear every 3 years. C. Pap plus HPV co-testing every 3 years. D. Pap HPV co-testing every 5 years. Answer: Pap HPV co-testing every 5 years. Explanation: USPSTF recommends PAP every 3 years or PAPS HPV every 5 years in women 30 to 65. Explan 3. Colorectal cancer screening. A 55-year-old man with no family history of colon cancer asks about screening. What is the USPSTF recommendation? A. Colonoscopy every 10 years, starting at 50. B. Colonoscopy every 5 years, starting at 45. C. Stool fit test every year. D. CT colonography every 10 years. Answer: Colonoscopy every 10 years, starting at 50. USPSTF recommends screening from 45 to 75 with colonoscopy every 10 years or FIT annually. 4. Lung cancer screening. A 60-year-old man who smoked 1 pack day for 30 years and quit 5 years ago asks if he should be screened for lung cancer. What is the USPSTF recommendation? A. Low-dose CT scan annually. B. Chest X-ray annually. C. No screening needed since he quit. D. Sputum cytology every 2 years. Answer: A. Low-dose CT scan annually. Explanation: Annual low-dose CT is recommended for ages 50 to 80 with 20-pack year smoking history. 5. Prostate cancer screening. A 55-year-old man with no symptoms asks about PSA testing. What does the USPSTF recommend? A. Routine PSA testing for all men over 50. B. No PSA testing at any age. C. Shared decision-making for PSA in men 55 to 69. D. PSA testing starting at 40 for all men. Answer: C. Shared decision-making for PSA in men 55-69. Explanation: USPSTF advises discussing risks-benefits before PSA testing in men 55-69. Metabolic and cardiovascular screening. 6. Hypertension screening. A 45-year-old man with no prior history of hypertension comes for a checkup. How often should his blood pressure be screened? A. Every 3 years. B. Every year. C. Only if symptomatic. D. Every 5 years. Answer: B. Every year. Explanation: USPSTF recommends annual BP screening for adults 40 or those at risk. 7. Type 2 diabetes screening. A 38-year-old woman with a BMI of 30 asks about diabetes screening. What is the USPSTF recommendation? A. Start at age 45 unless high risk. B. Start at 50 for all adults. C. Start at 35 for overweight or obese adults. D. Only screen if symptomatic. Answer: C. Start at 35 for overweight or obese adults. Explanation: USPSTF recommends screening at age 35 if BMI 25. Dyslipidemia screening. A 42-year-old man with no risk factors asks about lipid screening. What is the recommendation? A. Lipid panel starting at 45. B. Lipid panel starting at 35 for men and 45 for women. C. Only screen if BMI 30. D. Lipid panel annually for all adults. Answer: B. Lipid panel starting at 35 for men and 45 for women. Explanation: USPSTF recommends lipid screening for men 35 and women 40-45, earlier if risk factors exist. Mental health and substance use screening. 9. Depression screening. A 26-year-old woman with no past psychiatric history comes for a routine visit. Should she be screened for depression? A. Only if symptomatic. B. Only if she has a family history. C. Yes, all adults should be screened for depression. D. Only if she requests it. Answer: C. Yes, all adults should be screened for depression. Explanation: USPSTF recommends depression screening for all adults. 10. Alcohol use screening. A 30-year-old man drinks socially. What is the recommended screening tool for unhealthy alcohol use? A. Cage questionnaire. B. Audit C or single question screening. C. Only screen if there are signs of abuse. D. No screening needed under age 40. Answer B. Audit C or single question screening. Explanation. USPSTF recommends screening all adults using validated tools like Audit C. Vaccination Guide 11. HPV vaccination. A 17-year-old girl has never received the HPV vaccine. What should be recommended? A. No vaccine needed after age 15. B. 2-dose series of HPV vaccine. C. 3-dose series of HPV vaccine. D. Single-dose HPV vaccine. Answer. C. 3-dose series of HPV vaccine. Explanation. If the first dose is given 15 years old, a 3-dose schedule is needed. 12. Pneumococcal vaccination. A 66-year-old man with COPD asks about pneumococcal vaccination. What is the correct schedule? A. No vaccine needed before age 75. B. PCV20 or PCV15 followed by PPSV23. C. Only PPSV23. D. Annual pneumococcal vaccine. Answer B. PCV20 or PCV15 followed by PPSV. Adults 65 should receive pneumococcal vaccination. 13. Influenza vaccination. A 50-year-old woman with no comorbidities asks if she needs a flu shot. What is the recommendation? A. Annual flu vaccine for all individuals stay 6 months old. B. Only for elderly and immunocompromised patients. C. Every other year. D. Only in high-risk groups. Answer A. Annual flu vaccine for all individuals 6 months old. Explanation. Annual influenza vaccination is recommended for everyone. That hepatitis B screening. A 28-year-old healthcare worker has unknown hepatitis B vaccination status. What should be done? A. Check anti-HBs titers, then vaccinate if negative. B. Give a single booster dose. C. No action needed. D. Give immune globulin only. Answer A. Check anti-HBs titers, then vaccinate if negative. Explanation. Healthcare workers need serologic confirmation of immunity. 15. Tetanus vaccination. A 34-year-old man sustained a clean wound. His last TD booster was 8 years ago. What is the correct action? A. Give Tdap booster. B. Give tetanus immune globulin. C. No booster needed. D. Give Tdap and TET. Answer. Give Tdap booster. Explanation. Tdap is recommended every 10 years.